The doctor's office, like every other institution, is a social system. And social systems do not treat everyone the same. I have spent a surprising amount of time lately dealing with doctors' offices, exams, follow up appointments. And one thing that's become increasingly clear is that these are not neutral interactions. We tend to believe that when it comes to healthcare and medicine, because it's science based, right, or scientific, we're not going to experience the same kinds of biases or discrimination that you may experience in other institutions like education or politics. But that's just not true. The medical institution is full of humans, and humans carry assumptions. We are all socialized to have certain ideas about who we are, about other people, about what's right, what's wrong, what's appropriate, what's not, what to expect in certain settings and situations. So we all go through this cultural socialization. And from that, we develop a lot of biases. We develop a lot of prejudices, even if it's something as small as whether you like onions or not. You know what I'm saying? But a lot of times, these biases and prejudices turn into discrimination. And that happens when they become operational, when they become embedded in our social institutions. And the fact of the matter is that all of our social institutions have the same problems that the larger society deals with. They have the same problems of racism, of sexism, of discrimination. It's all there. It doesn't disappear when you walk into a hospital. Think about all the different people that you interact with in a typical doctor's visit. You're not only seeing your doctor. When you come in, there's the receptionist. Then maybe a nurse sees you. And then maybe you'll see your doctor after that. That's 3 different people already. For some people, there's many more individuals that may be involved depending on the circumstance. So you're being socially read before you're ever medically treated. When you walk in, the receptionist is already formulating ideas about you. Your tone, your demeanor, how you're dressed, maybe even how you smell if you have a smell, whether you have insurance or not, what kind of insurance you have. And then you interact with the nurse, who also has their own inventory that they're collecting in their mind, if not on paper. Those same factors are being considered. How you are presenting yourself, what you look like, how you talk, whether they can place you in the category of polite or combative. And then in comes your doctor, who's going through all of those things that the nurse has noted, right? And then the doctor does their own assessment, not your medical assessment yet. We're still talking about the social assessment. The doctor is also scanning for those exact things. And this doesn't mean that inevitably the result is mistreatment or, not getting the proper care that you are intended. That's not a natural consequence. There are still decisions that individual people make, consequential decisions when it comes to our health. But they become invisibilized even by the medical professionals themselves sometimes, because they're also operating under this, well, I took the physician's oath. Well, my findings or my understanding is based on research and science. So that's always a safety net for them, even as they may be dealing with some apparent, biases in their minds. And this is meaningful to me in more than one way. I'm not just interested in this sociologically, I'm interested in this personally. These kinds of things personally impact my life. As a Black woman living in the US, I have had countless experiences like this with doctors and nurses and medical staff where I've been dismissed, where my pain has been minimized, where I've gotten different diagnoses from different people. I had one situation where my doctor had a particular diagnosis and sent me to another doctor at a hospital. And that doctor completely reduced the treatment that they were supposed to provide to me after seeing me and talking to me for 3 minutes. My doctor actually filed a complaint against that doctor. This is just one example. These are just a couple of examples of things that I've gone through numerous times as a Black woman navigating the healthcare institution in the US. Black women are 3 times more likely to die from pregnancy-related issues than white women. Black maternal mortality has become its own case study in medicine. I had a student just this semester write a paper on this. And guess what? I've had students note this in previous years as well. So this isn't just anecdotal. It's not just a few people. You can get on Threads or Twitter right now, and you'll probably find one of these stories on there. Not a week goes by that I don't see some story about a pregnant woman dying due to neglect, social medical neglect. So this is backed up by data. Pain management studies have found the same things. As I mentioned in my own personal situation, Black women's pain is constantly minimized and the responses to their pain is taken less seriously than other patients. Survey after survey of Black patients in general, but Black women in particular, have reported feelings of being mistreated in the medical establishment. So this is real. This is real for me, but this is a real social phenomenon as well. There's a lot of different things that I could talk about as it relates to this sociologically, because there is an area of sociology that deals specifically with healthcare and the scripts and things involved, the formalities involved in this particular institution is really interesting. You should look into some of that. But I think when it comes to authority, there's kind of a point where it's difficult for patients to feel like they can even say with confidence what they're experiencing, especially if that is oppositional to what the doctor thinks or what they think the doctor thinks, because of course the doctor is the expert. The doctor has the credential. In the doctor's offices, you can see the degrees on the wall many times, right? And their awards and all that on the walls. So you walk in and there's this formality, there's this setup, this posture of authority in that space. And the authority is not yours, it's theirs. So you're contending with that, and that's very unique in this particular establishment as well. We as patients have to establish authority, and not just that, we have to establish credibility about our own health, about our own feelings, about our own experiences in this setting. Because the doctor or the nurses, especially the doctors, assessment reigns supreme in this institution. And so it becomes very difficult for us to have an oppositional view or to ask for more than what's being presented to us, to ask for something different. That's very difficult for people. And it's hurting a lot of people, the lack of speaking up for ourselves and challenging things that don't feel or seem right to us. So it's really important to think about the dynamics of authority in this space as well. And I guess one more thing that I want to mention is that mistreatment in medical establishments isn't always hostile, right? It's not like you're coming in and the nurse or doctor or receptionist is calling you a racial slur. It's happened to people before, but I don't think that's the regular experience for most people. It's more subtle than that. It's when you're trying to explain yourself and you're being interrupted before you can even finish your sentences. It's when the doctor comes in and they're obviously in a rush, just whipping through your file, barely hearing what you're saying before they move on to the next patient. It's about your thoughts and feelings being undermined. You say, this is what I'm experiencing. They say, oh, I actually think it's this. You say, this is what I would like. And they say, I think this is a better option. Those are the things that are frequent. It's not always, or it's much less likely to be this blatant, hateful type of discrimination that happens. It's very subtle, and that's what makes it powerful. And that's what makes it really dangerous as well. I think what these appointments have reminded me of is that bias doesn't disappear just because a setting is professional or credentialed or educated. Systems are always made of people, and those people have baggage. That baggage of assumptions, a whole bag of assumptions that they're bringing into every interaction. So this is what we have to keep in mind. And I appreciate you following this video into the end. This is Class with Prof. Eve, where we use sociology to make sense of everyday life. Make sure to like and subscribe before you leave, and I'll see you in the next video. Peace.